What's up? I'm Coach Dan Blewett. I'm a former pro pitcher, and I'm also, unfortunately, a two-time Tommy John surgery survivor. So in today's video, I've got Frank Alexander, who is the head athletic trainer and physician extender for the rehab team for Dr. Chris Ahmad. And Dr. Chris Ahmad is the New York Yankees team physician. So Frank is an expert on pitching injuries. He has tons of experience helping rehab ball players from all sorts of throwing injuries. But we're going to talk today, and this is the first video of a series of basically all about the UCL injuries that you'll face, what the different rehab and treatments are, and what you can expect if you do get Tommy John surgery or the UCL repair surgery. So in today's video, video number 1, Frank and I are going to talk about, so you injured your UCL. So you've got this diagnosis, you've gone to see a doctor, or you just have some elbow pain, you're concerned about it. What's going to go on? So stick around. This is a great conversation, and be sure to check out the description below where you'll find timestamps so you can jump around to the different topics that we cover in this video. This video is a little bit long, as are the other ones in the series, but we wanted to be really thorough to help families through, this really tough time when your son or daughter is injured and you're all scared and there's a lot of unknowns. So we wanted to walk you through that. All right. So Frank, obviously when people get the bad news that they have a UCL tear, whether it's partial or full, and a lot of times, they get this news, they don't know what their full prognosis is yet. How do people react when they come into your office for the first time and they've got this bad news? I mean, what should they be preparing themselves for as far as this pretty terrible news?
There's a couple different things that we talk about with patients in the office, and one of them is if they are coming in for a second opinion, that's very helpful for us because they already know their diagnosis and we're not hitting them over the head. It's not a gut punch right then and there. I've seen kids when they come in and they're just saying that their elbow hurts and they don't know, nobody's gone over their MRI scan with them. Maybe they haven't even gotten an MRI scan yet. So when the guys do have an MRI and nobody's gone over it with them and they're hearing for the first time, I've watched kids retreat into themselves and just put up that hard wall around them. Yeah.
Their head just slinks in like a turtle. Yeah.
Yeah. I watched a kid he was 15 or 16 at the time, and I just watched him literally shuffled his butt all the way back to the edge of the table and put himself up against the wall. It was really unfortunate to watch that unravel, and my heart broke for the kid. And at the end of the appointment, the mom goes, "Why do we need to see the doctor that takes care of the Yankees?" And I said, "This is exactly why. And it's because we're doing this as frequently. And unfortunately, we see so many players that are coming through and getting hurt, and they have that unfortunate diagnosis."
Yeah, obviously, I think this falls into the category of, throughout all of our lives, you hear on the news, these, someone gets in a car accident, someone has cancer, people, get shot. There's all these terrible life events that can happen that always seem to happen to other people, right? And for ball players, like I remember the day that I got the news that I needed Tommy John surgery in college, and it was just like, oh, I'm one of those people today. Like, it happens to everyone else, but today it's like, and it's a big shock that you hear about this all the time in baseball. Major leaguers get hurt, everyone gets hurt, but you never think it's going to be you. And it is a really big shock and kind of leaves your jaw on the floor. It really deflates you for sure. Obviously, I had 2 partial tears and 2 full tears. So I've gotten that news multiple times, and it's hard, and it does take a lot of emotional support. So you just brought up a good point, which is parents ask you like, hey, why do we obviously you're the ATC in Dr. Ahmad's office, and he's the Yankees head team physician. Why do we need to go find a really good baseball-focused doctor?
A lot of the times, and Dr. Ahmad and I do a lot of lecturing in the general community, in the baseball community, and we actually had a physician in one of our talks once, and he said, I've probably, UCL injuries have seen more of me than I've seen of them. So you really want to go to a doctor who, wherever you live, if it's in LA, you want to find the team doctors for the Dodgers. You want to go see a major league team physician. If you're not in New York, of course, we want to see you in our office, but wherever you are, you want to make sure that you're seeing somebody with volume, because they're going to know exactly, and when I say volume of UCL injuries in their practice, because just because they have seen a couple, you need to see the guys that are doing 5 of these a day. This week alone, Dr. Ahmad did 6 out of, I think we had 12 surgeries today. So half of our caseload was UCLs. So that is extremely important for parents when they're trying to advocate for their kids and where should we go. Local doctors can be very effective and helpful, but when it comes to the technical aspect of the surgery, you're definitely going to want to seek somebody with a wide, vast experience.
Yeah. And I've had, so I lived, for context here, I live in Washington, D.C. now, which when you live in a metro area, there's tons of good doctors everywhere. And obviously there's, like you said, there's good doctors everywhere, but there's, like the Washington Nationals team doctor is going to be here, the Washington Wizards team doctor. Like there's some really high profile physicians taking care of high profile athletes. And of course, I used to live in central Illinois, much smaller town, still some really great doctors there. But like you said, less volume because there's just less people and you're farther away from these metro areas of millions of people with lots and lots of athletes. And so for me, my first elbow surgery, I was pitching at a small D1 in Maryland, UMBC. And, our team physician, he did some surgeries on guys, but he was more of his specialty was hands. And as I just sort of bounced things off, and this was my first time navigating a surgery, I bounced things off teammates and asked them what their experience was. I asked other people and I got a second opinion. I went to the Phillies team doctor up in Delaware. And I was happy with that decision because I knew at the very least, this guy was taking care of multi-million-dollar athletes, right? He did Kurt Schilling surgeries. And then years down the road, when I blew my elbow out a second time and needed a second Tommy John, the doctor in Evansville, Indiana, who was a really nice man and I'm sure a great surgeon, he was honest with me. And he said, look, you're the first MRI I've read of a pitcher who's retorn a first Tommy John surgery. I've never done a revision surgery. He said, so I suggest you find, I can give you some recommendations, but there's only probably a handful of surgeons in the country who've done revisions. And that was true. So I went to Cincinnati to Dr. Tim Kremchek, who had done still only a small number of revisions because there's not that many people like myself in the world, unfortunately, who've had it twice. So just if you have that volume, then he'll eventually get some revisions. So, and one other quick story, I advised a kid in my area that I trained who went to a local small college, and he was told he needed Tommy John from the local team surgeon. I said, look, I think you should get a second opinion. It's always a good idea to get a second opinion. So he drove to Cincinnati, 5 or 6 hours, not a short trip, cost some money to get up there. And he saw Dr. Kremchek and he said, you don't need Tommy John. And he got a different, much less intense surgery. It wasn't the repair. He just his ligament was okay. So like you said, just seeing that volume, his eyes, having done thousands of these surgeries, his diagnosis was different than this smaller town doctor who I'm sure was still a very good doctor, but just hadn't seen as many. So, for parents out there, it's really important your kid only gets one arm and they only get one career and it's very time sensitive. So you have to be, it's worth the extra couple $100 in travel. And, maybe you have to wait a little bit to get a good, a really a team physician on the line. But, I think it can be worth it.
Baseball players' careers are finite. There's a timeline on them. There's an expiration date. There is no, oh, well, I'll revisit this in a couple of years. When you're out of the game for a while, you're out of the game. And it's tough to get back in. The one thing I will say there's out of all the doctors and the people that I've met throughout my career in baseball, there's not a team physician that I have encountered that wouldn't see a baseball player that is looking for another opinion. And there's a couple of ways to go about getting another opinion. And one, if you're not comfortable with the diagnosis, obviously you want to get confirmation of diagnosis in that second opinion. What can happen, and we see it happen frequently, is where players get the same diagnosis, but now the treatment options vary. And so Dr. A told you PRP, Dr. B is telling you need surgery. And now you're saying, well, oh crap, now what? So that's one of the things where it may actually warrant getting a third opinion. Sometimes, we've seen patients for 4th, 5th, 6th opinions. That's a little sometimes crazy, especially if you're hearing the same thing. But if you haven't found the right doctor for you, for your child, then it's something that you really, parents, advocate for your kids. This is, nobody in any of these doctors' offices will ever turn you away.
And then one thing I want to cover, so obviously there's a lot of things that can be going on in your elbow that's not just a UCL injury, right? You can have bone spurs, you could have ulnar nerve pain, you could just have tendonitis. And not every kid that comes into the doctor's office immediately needs an MRI. I think that's a big misconception. A lot of times people will go to a big team physician and they'll say, yeah, like I'm here because give me our MRI. And they'll say, we don't necessarily need it on every single case. I've encountered that. A lot of other people have encountered that. Can you talk a little bit about the different things that can go on the elbow? Because it's not always a UCL injury.
Yeah, no, there's so much that can go on in the elbow. And we half jokingly say that when patients point to the inside part of their elbow, what we call the medial side, when that is like a 50 or 60-year-old patient coming in saying, I have pain, and they're putting their hand over their chest. It's not a medical emergency in that regard, but that's something that we take very seriously. There is elbow pain on the outside part, the lateral aspect. You can get injuries such as osteochondritis dissecans. That's very prevalent in overhead athletes, baseball players, softball players. Actually, the two highest patient populations we see that in are baseball players and gymnasts, just because of the amount of weight loading through their upper extremities that gymnasts do. But there are some, to your point, Dan, there are some injuries that do warrant further imaging, x-rays, MRI scan. But there are some things that usually in a 10 to 13-year-old, just a plain simple x-ray will tell us what we need to know. Something like little leaguer's elbow is a chronic overuse injury that the kids just need rest from. It's probably the most frustrating injury that we take care of in the office because there is no surgery. There is no medication. There's no injection. There's no,
you just have to sit out.
Real thing that, there's nothing that we can do to speed up your timeline.
And those little leaguer's elbow, is that growth plate inflammation or is that a combination of things?
Yeah, that's growth plate inflammation. It's called a couple different things: little leaguer's elbow, medial apophysitis. But little leaguer's elbow is that chronic overuse of the inside part of the elbow where the growth plate is. It's a inflammation or separation.
Got it. So obviously there's a lot of different things that can go on. If you're watching this video, you probably have gotten a UCL injury diagnosis. But again, there can be partial tears. There can be full tears. You can recover. My first elbow injury was a partial UCL tear when I was a sophomore in high school. And I made I rehabbed successfully until I was a junior in college. That's when I re-injured it. And then I needed Tommy John the next year, actually. So you can make it quite a long time with rehab. So, people should remember that that's always the first option to try. And there's good prognosis from that. If I hadn't played college baseball, I would have just had a partial tear, would have rehabbed fine, and I would have gone on the rest of my life. I'm fortunate to play college baseball, and that did end up resulting in me getting a surgery. But, a lot of people will get that and come back just fine, and they'll go on their way. So before we wrap up, let's talk a little bit more about the emotional part of it. Obviously, I've been through this twice. I had Tommy John twice, and I also had additionally 2 partial tears. I pitched through pain most of my career. That was more normal for me than not. And, it is emotionally hard. I think when I retired, I had a lot of grief, just grieving my career that I pretty much bottled up my whole playing career. I just sort of pushed it down like most men do and just sort of kept going. I didn't talk a ton about it. I did a rehab series here on YouTube back in the day that chronicled my elbow surgery. But even then, I wasn't opening up about it a ton. I was just sort of like, here's what the day-to-day is like. You can see me throwing. You can see me. And obviously, I'll link to that in the description below. But Frank, you obviously care a lot about the emotional side. I mean, what are some of your takeaways? I know you said you're doing that study. But what should people know about the emotional side of these injuries, and how can families support their kids?
Yeah, a lot of these guys, when they come into the office, if they don't know what their diagnosis is already, they're sitting on their palms, they're sweaty, their parents are, or whatever loved one is with them, maybe on the other side of the room, and it feels like they're miles away, even though they're less than 6 feet in some situations. And it's normal for guys to be pissed off and angry. It's you mentioned earlier, like, hey, I saw this happen to everybody else, but now why me? just knowing, having that awareness. Look, nobody ever puts themselves on the field saying, "Oh, I'm never going to get hurt playing this game." You hope you never get hurt, but the reality is, whether it's a pulled hamstring, an ankle sprain, whatever, bumps and bruises along the way. Look, college seasons when I was playing, and Dan, I'm sure I played at the Division II level. We played 60 games. I don't know how many you guys played back then. Our careers overlapped, but I don't. 60 games is a long season because, especially in the Northeast where the weather is not great, it's very short. So it's normal to be angry that, hey, this happened to me. And it's okay that sometimes guys get emotional and they're watching their hopes and dreams get shattered in some situations. It's a crappy situation. We're very aware of that. But you know what? Your team and your teammates, your friends, your parents, your loved ones, everybody's here. We're all team you. And that's the one thing to really hang your hat on at the end of the day, is knowing that you have a good support system. Even the sports medicine team that's taking care of you, if it's myself, Dr. Mbad, and your athletic trainers at school, it's good to know that you have people that take care of you and really care about you, not just as an athlete, but as a person as well.
Yeah. And, for me as an athlete as well, because, I played, probably didn't play 60 games. I know D1 was a 56 game schedule, but I think always had 5 or 6 rainouts that we just couldn't make up because, like you said, that sweet mid-Atlantic weather. But yeah, it's hard. I think one of the big things is the disappointment of feeling like you let other people down by being injured, which is crazy. We all feel that, but especially when you're a good player and a contributor, everyone misses you out there. And you just feel like you let people down, and it sucks. And that's a really tough part of it. And that's, which we'll talk about in coming videos. That's also part of the rehab that's hard to override. Like you need to be on your own timeline with all that. Now, I think one of the things that I would recommend people do to help their sons in this situation is don't just ask them how they're doing. Don't say, "Hey, how are you feeling?" Because if it was me, I would just say, "I'm okay. I'm fine. It's fine. Like I'm whatever." Right? That's what we all do. Just like, I don't advocate for pitching coaches to ask their players, "Hey, how do you feel?" Because they're always going to say, "I'm fine." That's what I did my whole career. If I had a son going through this, I would write myself a list of how I would assume that he's feeling. And I would just walk up to him. I'd be like, "Hey, I bet you're really disappointed that you feel like you're letting your teammates down, aren't you?" And they can say no. But if I nailed it, then they'll probably talk about it. Because I know if someone said that to me, I would be like, "Yeah, I do feel that way. And it sucks. And I wish I was out there." And I think that's a really good way to get these kids to open up when they've been, conditioned to be tough. And look, you have to be tough. I mean, no one wants to hear you whine about your injury in the dugout. They just don't. Everyone has their own problems. But I know as a player, you do need to just try to put yourself out there and find a teammate you can talk to about it. Ask them if you can vent. And then parents, just like I said, leading questions are good. Say, I know you're probably really nervous that you're not going to come back as well from this, aren't you? That's 100% of players think that. 100% of players are worried about that. So if you just throw that out there, they can either say no, and then they're in control of the conversation, or they can say, "Yes, you're right. Like, yeah, Mom, that's how I feel, and it sucks." So, just think about some of that. And the emotional part, yeah, that people around you care about you and support you. But I think really having a chance to vent and have other people really deeply listen to you, and not just people say, "Oh, you'll come back, you'll come back, you'll come back." Like, okay, that's fine. That's nice positivity. But would you mind if I just share how I feel and get some of this off my chest? Because that's, I think, what players need more than just the rah, like you'll come back positivity. They need both. But I think more than anything, they need to be at an event and get some of that out.
For sure. And one of the other things too is if it's not your child that's going through this right now and it's your son's friend, don't tell the kid, "Hey, we really missed you out there." The kid misses being out there already enough. He doesn't need to hear it more from extrinsic factors. Some of these guys they beat themselves up over this. And they feel they let down their parents because now they can't get drafted this year, or they didn't get the scholarship that they were hoping for. It can really be detrimental.
And last thing, so obviously everyone's different. Everyone wants to say, "Oh, here's the timeline. I'll be back in 12 months. If this happens, I'll be back in this amount of time." But everyone's different. I mean, how big of a variation in range of recovery time and outcomes do you see between people who are we're all different?
That's another really good question because there is so much variability to it. No two patients are identical. We have kids, at least in the New York area, we take care of Manhattan College, we take care of Fordham, we take care of Columbia. We take care of St. John's as well. A lot of those guys are coming to us for their UCL injuries, and none of those two guys are the exact same. The overall theme of their recovery is I tell guys, it's like the stock market. There's going to be good days. There are going to be bad days, but as long as the general trend is positive, everybody's happy and we all celebrate. With with receiving a diagnosis, again, there's so many different intricacies for it. We've had some guys who are at the college level and their athletic trainers tell them, oh, you don't need an MRI scan yet. And sometimes it's an unfortunate situation because they've kicked the can for 4, 5, 6 weeks. And that could have been now, instead of it being, they get hurt in January, now it's mid-February. And now they're looking at recovery encroaching possibly their next season. So any player that's having elbow pain, it's definitely, I implore you to be your own advocate. If you're the player, if you're the parent listening to this, check in with your kid. There's nothing wrong with saying, hey, maybe it's time to get this looked at. There's one thing, we joke, and I had a conversation with a couple PTs and our nurse practitioner in our office yesterday. And we were half joking about, is the kid hurt or is he injured? And having the ability to differentiate between post-game soreness and, hey, I felt a pop in my elbow and something is not right. That is a very important factor when you're initially going through this process.
Yeah, and that's a good point because, like you said, kicking the can, there's definitely a time where you want to try this. So my second partial tear of my elbow, this was in college, and I came back, made a whole nother season. But then that next season, my senior season, I heard it again, and I thought it was done. I went to the doctor. He said, I'm not sure that it's fully torn. He said it's a little murky on the MRI. I think we should give it another month. Since I know you're coming up to the end of your college career, let's give it another month and see if we can avoid surgery. But if you have any pain during this rehab, after you rest and then we go back through your rehab throwing protocol, if you have any pain, then you got to come back and get Tommy John. So that did end up sort of kicking the can down the road where I ended up not getting surgery. I came out of the game in late May and ended up getting surgery in late August. And that effectively ended my senior year, my fifth year, my super senior year in college, because we delayed it. But in that situation, the doctor wasn't trying to be quick to cut me open. He was trying to help me come back. And so there's always that give and take, and it's hard. And that's where, you want to get good advisors and a good medical team who can say, hey, this is what we think. Here are your options. Nothing's ever certain. I could have come back from that and pitched a great senior year in college, healthy. We didn't know, so we tried.
Yeah, there's a lot of that we talk about in the office. We call it seasonal and career timing. Where are you at in your individual season? Where are you at in your overall career? So I was talking to a PT yesterday in Boston, and we have a kid who's at a university out there, and he said he's a year and 5, 6 months out from his primary UCL reconstruction. So first UCL, he had a little bit of a flare up this past fall, and we gave him PRP injections, tried to get him ready for this season, came back. He was throwing bullpens, redeveloped elbow pain again. We've had MRI scans on him. And so his PT was like, we gave him a dose pack. We said throw in about a week, because now we know he's 21 years old. He said, I am pitching this season. And he's 21. I think he's a 4th year guy. Obviously with COVID and red shirts, he's going to be able to get some more time out of it. But he's at a point in his season and his career that he wants to be ready to play for these playoffs. So we're going to be a little bit more aggressive with him. If he was a freshman and he had surgery in junior or senior year in high school, maybe we wouldn't be as aggressive. Maybe we would say, let's dial this down, or we would say maybe another PRP injection. You're done for the season. Let's revisit this in the summer. Parents that are having kids that are losing their junior year, that is a huge factor these days with that. I feel bad for those kids, but and especially now the guys that are coming out, their careers have been affected by COVID in more ways than one. Their recruiting has been affected by COVID in more ways than one. And the psychological impact of this has really reared its ugly face for some of these kids. It's actually something that we're studying, actually PTSD in guys that have injured their UCL. We have 75 guys in our study right now. I'm trying to get 100 before we publish. But in those 75 players, out of a possible score that could be in the 60s, the highest score I've seen as of right now is 54. Anything above 30 on the questionnaire that we're giving these kids is shown to have future immune system compromise. So kids that have injured their UCL are now experiencing levels of PTSD that we're seeing that are comparable to soldiers coming back from war. It's pretty interesting to see that. And it's also scary as a healthcare professional to know that these kids, an injury that a lot of guys, 90-something% of guys come back from this and they're able to get back to the same level of play. Some go even beyond, but their stress levels are so high that it's really concerning.
All right, so thanks for watching. Again, check out the description. You'll find links to all of my other Tommy John videos. You'll find links to follow up with Frank Alexander. You'll find links to Dr. Ahmad's team. So if you want to, get a consultation with them, if you have this injury and you want a second opinion or a first opinion, you're in the New York area or not, I know they treat patients from all over. You'll find links in the description below to reach out to them. Thanks again for watching, and we'll see you in the next video.